Barney, and I am the Health Sciences Program Coordinator. Welcome to our Medical Assisting Lab. My job as a Health Sciences Coordinator is to help the students work through the prerequisite classes and learn how to become eligible to apply for our Medical Assisting Program. Right here, I have our Program Director, Ms. Jacqueline Valenti.
Hello.
She is going to discuss a little about the program for the medical assisting, what to expect in the program, lectures, lab, and a little information about our clinic sites.
Okay, just to get started, we're going to talk about salary first. Salary is it's a very wide range of salary options that are out there. Depending if you want to stay more rural or if you want to go more towards the city, it can really vary hugely. So starting out in the Beaufort County area, we would see something starting anywhere from $15 an hour all the way up to $18, $19 an hour, depending on where you're working. If you want to work on Hilton Head, you get a little bit more money, things like that. If you decide to go more towards the city, you may start at 18 typically and go up from there. Having your national certification will always bump you up even a few more dollars from there. As far as the profession itself, it's always continuing to grow. What we're seeing across the board in all medical professional jobs and in all the professions in general is that because of the baby boomers, because of the large amount of people that are currently retiring, that are getting past that age of 65, moving into retirement areas such as ours, we're seeing a huge need for medical professionals, and the job market is crazy, and you'll basically be able to find yourself a job. If you're looking, you'll be able to find yourself a job very quickly. The other thing that we're looking at is across the board, people are living longer. Medical advances have come so far, and being a part of the medical team, we're all working towards the best care for that patient. So they're living longer lives. We're having less errors due to electronic health records, better documentation, and better teamwork. The next thing that I want to talk to is why somebody might choose medical assisting. It is a good starter position. It's a good entry-level position. Medical assisting is going to put you into a job where you're going to be able to do a 9-to-5, work a 9-to-5, no weekends, no holidays if you want to. You can obviously take those different shifts and maybe make a little bit of a differential, a third shift differential or something along those lines to make a little extra money. But you can typically get a 9-to-5 Monday through Friday position. And that works out well as a stepping stone for other programs. You're going to get your feet wet out in the field. You're going to be able to get recommendations, and you're going to be able to possibly even get tuition reimbursement. Once you're in the field, you've got your foot in the door, and then you can start working towards something like nursing or other professions from there. What you can expect as far as completing the program or what you would get from the program. We would cover 3 different semesters of courses. So you would start out in the fall, and we would cover 3 courses during that time in medical assisting program. There's some other prerequisites that you can either take beforehand or you can take actually during the program, and I'm going to have Ms. Barney talk about that in a minute. But typically in the fall, there's 3 medical assisting courses that you would take. Then we would break for our winter holiday break, and then we would also go into our spring semester, where we would take 3 more courses. This is going to teach you administrative and clinical skills. We do a lot of hands-on in the classroom, where we would typically meet a Wednesday and a Thursday, one day in Beaufort, one day in New River. And we would spend part of the day lecturing and different things like that. And then the other part of the day, we would end up in lab, where you can learn injections, phlebotomy, EKGs, throat cultures, flu testing, all of these different types of things you get to learn hands-on in the classroom before you go out onto what we would consider a clinical session. It's also known as a externship for us, okay? The externship would be a 160-hour on-the-job training almost, because you would complete and learn all of your skills prior to going out into that externship. The externship sites that we use are pretty much any doctor's office that is in and around this area. We have externship sites in Hampton County, we have externships in Jasper County, and we have externships right here in Beaufort County. That's with companies like BMH, Tenet, St. Joe's. We have basically clinical extern sites available in most of the medical facilities, doctor's care, and everything that's around here. So anywhere you'd see a doctor's office, that could be a potential extern site, or somewhere you might work eventually. Going from your externship, as far as what would be expected once you are in externship, is that you're in that summer session now. So once we complete the fall and the spring session, you would go into summer session, and that is basically when you would have your externship. And in that externship, you have 10 weeks to complete the 160 hours. So at bare minimum, you would only have to complete 16 hours a week, just like during the regular school time where we would meet only Wednesdays and Thursdays. You keep that 2-day schedule in the summer as well, where you have to complete 16 hours. So that would be 2 typical 8-hour shifts at a facility. Most students choose to do a 40-hour work week, and you can get it done faster, or you can do it slower, but you have to commit to at least 16 hours per week. So that's a little bit of kind of the general gist of everything in the program, and I'm going to have Miss Amanda talk a little bit about some other things that she wants to cover with our program.
So for the medical assisting program, it is a selected admissions program, which means you apply to the school and get accepted, and then you apply separately to the health sciences program. So what that means is we're weighted admissions applications. So there's prerequisites that are involved for our program, and the more prerequisites you have completed means the more points you earn on our application. Some students are eligible for applying to our program right out of high school. Some work on the prerequisite classes first and then apply. Applications are typically once a year, every spring for a fall start. And like Ms. Valenti said, it is a 3-semester program upon acceptance, fall, spring, and summer. We typically accept 16 students into the program, and they follow the instructions as Ms. Valenti just mentioned before. So we want to make sure that students are aware that they can take classes at any point in time during the semesters. If you're looking to start prerequisites in the springtime, summer, or fall, that's always encouraged, but the program itself would only run once a year in the fall time. Application information can be found on our health sciences website, or if you ever have any questions about if you're eligible to apply or what classes you would need to take, you're more than welcome and also highly encouraged to email myself as the program coordinator or Ms. Valenti, the program director itself. So we just want to say thank you again for watching our video and your interest in our medical assisting program. Any questions, we encourage you to reach out to us, and we're looking forward to seeing you in the future.
Thanks. All right, so first off, we're going to show how to draw up a medication. First, we would take an alcohol wipe and we clean the surface top of the bottle or vial or whatever we're using. You're going to draw up half. Yep. We're preparing to do an IM injection. That's why you see the length of that needle is pretty long. Going to stick it inside the bottle, and she's going to draw up. She's going to push the air in first, and then she's going to draw up the amount of medication that she needs. With the longer needles, we have to make sure when we're in the bottle to be in the liquid and not inside the air of the bottle, because what will happen is you'll just draw up a bunch of air. Okay, when we recap, first we make sure that there's no bubbles inside of there. Then we recap on this. We only recap on needles that have not been in skin. So this is not technically a recapping of a needle. We don't recap needles when they go in the skin. So that medicine has been prepared and is ready for transport. Okay, we've now entered the patient's room with the medicine, and we're gonna get prepared. We're gonna prepare the skin with an alcohol swab in order to give the injection. We're giving an IM injection today. There we go. Just giving the medicine. Being careful to pull out in the same angle that they went into. That's a vanishing point needle. That would then be put into a biohazard container, sharps container. If the patient is still bleeding, we will add additional gauze and additional wait time. And that's an IM injection. Today we're going to be doing an intradermal injection. An intradermal injection is generally used for a PPD or a tuberculin skin test to check if someone has been exposed to tuberculosis. This is also known as a tuberculin skin test or a MAN2 test. She's prepping the skin with an alcohol swab. And this needle will be just going right underneath the skin. We just cover the bevel of the needle, just pulling the skin taut to make sure that we try not to hurt them, get the skin prepped. Push just underneath the skin there. And out. With this particular injection, we don't put a Band-Aid over it because we don't want to push out the medication that's been put just underneath the skin. Okay, today we are going to do a subcutaneous injection. We're going to start off by prepping our skin with alcohol swab. Prepping the skin gets rid of any kind of contaminants or anything like that that would be on the surface of the skin. We can't sterilize skin, so this is the best way to clean it. She's going to go ahead and prep her needle by putting in about 1 of air, because this is not a real person, so we can't put liquid into this device. She's going to be going in at a 45-degree angle for a sub-Q injection, because we don't want to go down all the way down to the muscle, and we're not at the very surface of the skin. We're going to kind of go about halfway in, and we're going to go ahead and inject that person. Coming out at the same angle as we went in, and using gauze to cover our person from bleeding. We can use bandage tape, we can use Band-Aids, we can remove the gauze and put the bandage, all depending on how much the person's bleeding. She's going to activate her safety device to make sure that she doesn't get stuck with that needle, and then that would be disposed of in a sharps container. Sometimes in the field we might need to give epinephrine injection, which is also an intramuscular injection, but this isn't an emergency situation. If someone was having an allergic reaction, a bee sting, peanut allergy, or things like that, someone might have trouble breathing. They might signal us to give them their epinephrine injection. And we can help out, and this is what we use as a trainer. So we're gonna pull the safety so we can get that ready. And this would be going between the knee and the hip in there, right into this intramuscular or the vastus lateralis area of the leg. And so she's gonna go ahead and give that to me. And it's a pretty good jab, holding it in there, letting it drain. And when you come off, you tell the person, because you may not have gloves in the field. So you would tell the person to kind of rub that in. And that's how we would give an epinephrine injection in the field. We'd also document the time and make sure we give that to EMS.
The most challenge I faced was time management, and how I overcame that was I went and bought myself a planner, because all of my assignments was due on every Thursday each week, which was multiple assignments with multiple chapters. So I split my chapters up on each days. That way at the end of every Thursday, I wouldn't be so crammed up with assignments.
The reason that I wanted to pursue a medical assistant program is just to get more experience into that health field.
My favorite topic for the medical assistant would be so far the minor surgery chapter, where you get to do different procedures on patients. For example, getting draped for surgery or doing the strip test.
Well, for me in this program, it would be trying to get everything done before the due date. I know it sounds like the most simplest thing. You could probably say that it's a challenge, but in this particular program, you have so many things from one class and then another class to get done, and trying to get all of that and discussions, and because it's a lot that you have to get done. And even when you do discussions, you have to go back and respond to people, and some people forget, and it's just, you have so many things you have to do by a certain time that you forget to do maybe one assignment or this assignment. It's a lot easier to forget about them because you have to keep going back, because a lot of this stuff is online. So you don't get worksheets, like physical stuff that you take home and do or do in class. A lot of it is online. And a bigger challenge also is to have the proper Wi-Fi to do all of that at home or wherever it is you may be doing the work. But for me, at least, I bought a planner, and that has worked for me to put everything in that planner, and set my due dates and when I'm going to do this and when I'm going to do that, and little reminders to remind me to go back and answer somebody's discussion, or to go back and finish a assignment that maybe I put off for later for whatever reason. But that would be what one of the most challenging things so far has been in this program.
Keep your biology textbooks. I didn't realize how much I would need to retain all of my biology information until I was in the class, and if I had those books, it would have been very helpful.